Hello, everyone, and a welcome to the From Vaccine to Vaccination webinar series that's been taking place all this week. My name is Rola Kaakeh, and I'm the CEO of Salus Vitae Group, and I'll be the host for the event. Now, for those joining us for the first time this week, welcome. And for those that are returning, thanks for joining us again. Now, at this point in time, we're all waiting on the COVID-19 vaccine. Yesterday, here in the United States, the FDA External Advisory Committee recommended the emergency use authorization of the Pfizer BioNTech vaccine. We spoke with Catherine on Tuesday from London, and that was the first day they started vaccinating. They called Tuesday V-Day, or Vaccines Day. And then Canada was actually the third country after Bahrain and the United Kingdom to authorize their coronavirus vaccine. Now, we can all agree that the speed at which the vaccine clinical trials have been conducted, reviewed, and approved is truly unmatched in history. It's unlike anything we've seen before. But now, on the brink of this new vaccine, an enormous challenge awaits us: the distribution and administration of this future COVID-19 vaccine. We are now not only focusing on the vaccine, but on the vaccination process. Hence, we're discussing the From Vaccine to Vaccination. Now, as part of this week-long series, we've been very lucky to have 6 leaders from across various settings share their experiences, explore recommendations, and propose actionable strategies as we prepare for the deployment of the COVID-19 vaccine. These leaders come to us with diverse backgrounds and expertise. We had a health economist on Monday. We have various vaccination experts. We have executives of global organizations representing millions of pharmacists. We had a dean of a school of public health as well as a dean of pharmacy. We also have a pharmacy informatics administrator, as well as yesterday we had an on-the-ground clinician implementing the strategies discussed. Now today, over the course of an hour, we're going to ask our guest speaker a number of questions. I'm going to start, and then we're going to actually open it up to the audience questions. So please submit any questions that you have throughout our talk in the Q&A box, and we'll get to them towards the end of the conversation. We also encourage you, both during and after the event, to post your takeaways from the event in the Q&A box and on various social media platforms, and tag us at Salus Vitae Group. We want as many people as possible to benefit from the insights shared by our distinguished guests. So please pass them along. The session will be recorded and available for replay after the event. Now, all the recordings for the previous sessions will be available in the coming days, so you can check and find them at salusvitaegroup.com. So let's go ahead and get started. I am very pleased to introduce and welcome our guest speaker today, Justin Bates. Justin began his career in the advertising and marketing business before transitioning into the health insurance industry, where he worked as a consultant for a pharmacy benefit manager and as a principal in a health insurance brokerage. He spent more than 15 years advocating on behalf of the pharmacy sector in various capacities, including as Chief Executive Officer of the Neighbourhood Pharmacists Association of Canada. In his current role as Chief Executive Officer of the Ontario Pharmacists Association, he brings a strategic, collaborative, and transformative leadership approach while advocating and advancing the pharmacy profession. In addition to a bachelor's degree in political science and psychology, Justin holds a negotiation certificate from the Harvard Negotiation Institute and has completed the Institute of Corporate Directors program and the University of Ontario's Rotman School of Management Executive Program, the Not-for-Profit Governance Essentials. He also serves as a board director for the Canadian Foundation for Pharmacy. So welcome, and thank you so much for taking the time to be with us today.
It's my pleasure. It's great to be here.
So we have a rich conversation planned today. The general themes of what we're going to be talking about have been similar across the various guest leaders. Those have included some lessons learned and current strategies. We also are going to touch on workforce requirements and just the preparations for all of this. We are also going to talk a little bit about equitable access, as well as the ways to address misinformation and how to better communicate as we start these new initiatives, and then as well as the role of various stakeholders. And then we're going to conclude similar to how we've concluded in other sessions, where we're going to just talk about some advice for all of those watching moving forward. So let's go ahead and get started. Our first question is, what have we learned thus far from the current and previous pandemics and vaccines that will prepare us for the COVID-19 vaccine?
Well, it's a great starting question because we do have valuable lessons learned from both the flu shot campaign here in Canada that we just undertook under unprecedented conditions. When you think of the amount of demand and greater public awareness of the importance of getting vaccinated, which is really important. I think a huge part of the success of this launch of a COVID vaccine is going to be based on education, addressing some of the vaccine hesitancy, but also ensuring that we have all hands on deck. I mean, all healthcare providers need to be protected. They also need to be involved in vaccinating all of the public, because we've never really seen something of this magnitude from a global supply chain perspective to the logistics, the procurement process, approvals processes, and as well in terms of distribution to the various stakeholders that are going to be involved in this. So as a representative on the pharmacy side, what we saw during the flu campaign thus far, and we launched ours in early October of this year, is demand that we've never seen before. So that could be in part because of the fact that we're in a pandemic and there's greater awareness to avoid the twindemic, that phenomenon of having COVID-19 cases at hospitals as well as seasonal flu. And also, I think people are aware of the lockdowns and restrictions, all of the changes to our lives, the disruption. So I think the thought process is, let's get vaccinated to avoid more impacts and protect our economy, as well as protect the best interests of public health. So for that reason, I think we're going to see a significant surge from normal baseline levels of vaccination rates. And certainly part of that's going to be the role of the healthcare provider to address some of the vaccine hesitancy and be leaders as well. I think this is going to be really key. It's not just politicians and celebrities, but it's also the frontline healthcare providers, that if they can demonstrate that this is a safe and effective vaccine by going on social media, doing videos of them actually receiving the vaccine, I think it'll go a long way into instilling confidence into the general public that this is a safe vaccine.
So are you generally then learning from what you are doing now for the flu shots and the flu vaccine? Are you doing similar campaigns, or do you find that you're still, what are you specifically learning from the flu vaccine that can be transferred or that cannot be transferred when you think about campaigns for the COVID-19 vaccine?
Mm-hmm. So from our perspective, we're advocating for a greater role of frontline healthcare providers, including pharmacists. We think that certainly what our public opinion polling is showing, and our stats from year over year growth in the program through pharmacies, is that the general public is certainly seeing pharmacy as an integral part of a vaccine strategy. And that goes well beyond just the flu shot campaign and COVID vaccines. We're talking about addressing the gap that is existing today of less and less children getting their immunizations, as well as adult immunizations. So making it convenient and more accessible through pharmacies is really important. So that speaks to a large part of the allocation amounts. So looking at a formula of how much goes into the community through primary care providers, public health units in the case of Ontario that operate clinics, as well as through pharmacies. And then, of course, you're going to have your institutional care. It's a big part of this through long-term care facilities, hospitals, and so forth. So it's going to take a village. It's a group effort. But we know that with the demand, that pharmacy has to be at the table in terms of the ordering process and making sure that it is streamlined and efficient. And also transparent, and that we have the appropriate allocation percentage of the overall stockpile. In the Canadian context, as you mentioned on the outset, Health Canada did approve the Pfizer vaccine, but of course that presents a monumental logistical challenge. So our federal government here is procuring all of the vaccines and then coming up with a equitable distribution formula for the provinces to be able to then receive the vaccine. And we know with the Pfizer vaccine, once it's been delivered to that central location, it can't really be moved from there. So we can't leverage our sophisticated pharmacy-led distribution as we would typically do with vaccines and all other medications. So that's going to limit pharmacy and primary care physicians and other community providers to be involved in the first phase, which obviously now is imminent in terms of timing of the first vaccines being administered to patients starting next week. So we're really looking at this as potentially a phase 2, when perhaps the Moderna or even the Janssen and some of the other obviously promising vaccines become available. That would be more of a solution for pharmacy. But being at the table, we have the pharmacists at a provincial task force that's having some of these discussions about distribution, about the role of pharmacy from both the actual performing and administering the vaccine, but also the education. I think that is going to be really key. Having consistent and coordinated messages that all healthcare providers can use to educate the public, to answer questions about the vaccine, understand its efficacy, and address some of those challenges around the anti-vaxxer movement, which is still quite prominent. Yeah.
So you actually started to talk about, which is usually our second question, about strategies in terms of a global, statewide, depending on when you are, and then kind of the local level, and then the institutional level. And so with the institutional level, especially with pharmacists, they've really kind of stepped up and they've started to plan how they will administer the vaccine. Can you shed light on kind of that medium part? So you talked a little bit about the federal level, and then just what goes from the federal level to the institution where they're about to administer. Can you shed a little bit more light on that in terms of local health departments and what their role is?
Mm-hmm. So in the Canadian context, healthcare is a provincial jurisdiction. So the decisions about who would be prioritized in terms of first populations to receive the vaccination, in terms of the distribution and allocation amounts, all of that's done at a provincial ministry level. So we have a Ministry of Health and we have public health units that operate in each of the regions. So they will be inevitably part of the solution in terms of some of the accessibility, but in terms of the formula or the allocation amounts from the federal procurement process, that is done in part now. They have the military involved to be able to move this kind of volume of vaccines, and looking at different models. They haven't landed on the exact formula for determining from the federal government, how do you determine how much goes into one province versus the next. But some of the discussion points have been around a per capita basis, looking at populations and so forth and where that demand is. I know some provinces are also now engaging directly with the manufacturers as well to see if they can procure additional vaccines to fill any gaps. But I think that's the first step, is you've got to figure out the logistics component, the cold chain requirements, and getting it from manufacturer to the federal depot where it's all being procured, and then shipping it out in an equitable way to each of the provinces. And then the provinces will be tasked with, particularly with the cold chain requirements of the Pfizer vaccine, where you have it at minus 75 degrees Celsius. That's going to limit where it can be stored, and also where and who can get it, because there's a limited amount of that supply. So in the early days, in the first phase, the priority groups will be certainly healthcare providers in long-term care homes, nursing homes, as well as hospitals. And then we've got actually a formula of frontline healthcare providers, long-term care residents, so those that are in the homes, people that are over 80 years of age, and adults in Indigenous communities. So that's going to be our first wave as priority health populations. And then phase 2, which is not going to probably happen until in the late Q1 of 2021, will be broadening it into more of a community-based strategy. And then eventually, we have a target here in Canada to have the entire population vaccinated by the end of the year of 2021. And that's ambitious. I think we're starting off with less than 1% in the next month to 2 months in terms of total population being vaccinated. Then it runs into about 8% between January and March. So that for here, that's about 3 million people. And the bulk of the people that will get vaccinated will happen between April and June. And that's about 40 to 50% of the population. And then the remainder would happen between June and the end of 2021. So it's going to be a while before we get back to any sense of normal with the vaccine. It's obviously, it's a manufacturing and ordering process challenge globally. and then also just how do you enable all of these healthcare providers to have the education and also the supply in hand to be able to start the process. And I think one of the things you're going to see, particularly for the Pfizer vaccine, where that cold store parameters, cold chain and storage parameters is very restrictive, is likely similar to what we have here for public testing centers for COVID. You're going to have drive-throughs and or central locations where people can go. Just because of the requirements, it's difficult to then ship that product out to individual stores.
Yeah. So the next question pertains more to the pharmaceutical supply chain. This is something you and I also have talked about before, because the pharmaceutical supply chain is very global, it's very diverse, and we rely very significantly on each other in terms of many of the medications, because we know we have other health conditions, numerous other medications that the pharmaceutical supply chain needs to be suited to provide. But do you think that the pharmaceutical supply chain is ready to meet such a huge demand? And do you think that the vaccination distribution process is actually going to impact, will it impact the pharmaceutical supply chain, or are they ready, do you think?
Well, and we've seen drug shortages as a recurring issue, an ongoing issue, even before the pandemic started, and largely because you're seeing such a dependency on global supply chain issues and less domestic control over the manufacturing process and even policies. So with the margin erosion and deflationary pressures on the cost of goods of the manufacturers, particularly in low-cost jurisdictions like Canada and New Zealand and other jurisdictions internationally, that's caused a lot of outsourcing for the active product ingredients. You're seeing a lot of that done in China and India. And with foreign site inspections that closed down some of these factories and other supply chain interruptions, including shortage of the APIs, we've seen an increase in drug shortages. Then you have other recalls and shortages for a variety of different reasons. So that then became exacerbated with respect to the pandemic. In early March, you had stockpiling happening, and we saw a real strain on the supply chain. So in the Canadian context, most of the provinces went to a 30-day limit of medications to try to manage that and prevent a drug shortage. And I think in large part, it worked, but there still was some drug shortages. So now you add on to this complexity of the vaccine and just the sheer volume and undertaking that this is going to require. I think we're ready. I do think particularly in the pharmacy space, because we have a very sophisticated pharmacy-led distribution system, and the pharmacy wholesalers have been preparing for this for some time. Obviously there's a lot of advanced preparation that's going into this to prepare for the different surges in demand. But it is a good call out. And I think this is part of what we need to do, is make sure we have that surveillance and monitoring, particularly around data and IT, but also looking at it from the perspective of monitoring drug shortages, because what we don't want to do is introduce risk and continuity of care for patients where, on the one hand, we have supply going out the door for vaccines, and then we introduce some risks around medication management within the community. But I think that's a low risk at this stage. We've been doing vaccinations for some time, maybe not at this volume and magnitude, but for pharmacists to be able to manage this within the supply chain, and then bringing in resources like the military, who are logistic specialists, to be able to coordinate this, because that's really what it's going to take. It's a degree of coordination between multiple levels of government, multiple stakeholders in the healthcare community, and leveraging all of the assets that we have to make it efficient. So inevitably there'll be some challenges. We're certainly not have our head in the sand or naive about that. I think because we've never been through this before, we'll have some certainly lessons to learn from it, but we're certainly ready. And I think one of the value that propositions of pharmacy is that we have traditionally shown that we have better numbers when it comes to the ROI of distribution through pharmacy, less spoilage of vaccines and influenza and other vaccines and immunizations, as well as less wastage. I mean, our wastage levels of the flu vaccine are less than 6%. And in other parts of the system, it's in excess of 12%. So, that's going to be important too, because of the cost and other elements that we need to protect. We need to make sure that we do this in the most sophisticated way as possible.
Thank you for shedding a little bit more light too on the pharmaceutical supply chain for those that are listening with regards to what it looked like kind of pre-COVID and then what we can anticipate. I think for a lot of pharmacists or those within the pharmacy space, we recognize the limitations and vulnerabilities of the supply chain. So it is very assuring to get the, get your perspectives on that, the fact that we are really working to ensure that the supply chain is more resilient for this. I also think that your point about also tracking those drug shortages to see the difference of is it truly impacted, I think will be very beneficial for a lot of institutions, right? What will it look like? Because there are still a lot of institutions that don't formally track their drug shortages. They take care of them as they go wrong. But I think that's a great point too, because we're going to start talking also about different outcome metrics later, and that'll be interesting to see your thoughts on that. And so are there specific plans or policies or best practices that have gone out to the pharmacists or the healthcare providers or the various different stakeholders as you're preparing for next week?
Yeah, so certainly pharmacy won't be part of next week's rollout of the vaccination distribution strategy because of the some of the things we talked about on the outset of the complexity of well, first of all, there's not enough of the vaccine, so it's being targeted thus far to priority populations, but also the complexity of that particular vaccine. So I think we'll probably be more involved in a community broader strategy of vaccination of the COVID vaccine, likely in the springtime, maybe late winter. So all of what we're doing now is we're trying to work with government to make sure, that we have the scope of practice to do it. So it's going to be different because scope is different by province in Canada. But in Ontario, as an example, the largest province in Canada, we need a scope change, a regulatory change in order to enable pharmacists to specifically administer the vaccine. So that's one thing. It's going to take some time to go through the regulatory process with the college, the regulatory body of pharmacists, and also with government approval process and so forth. But that is moving through the process with government and the Ontario College of Pharmacists. But we need that. That's an enabler to doing this. And then we need to make sure, and we're working with all of our partners and colleagues in primary care to come up with the key messages, guidance documents, sort of SOPs as well, so that it's shared consistently with primary care physicians, nurses, and other regulated health professions who may be involved in this. And I think that coordinated strategy, it's not just education to the patient, but it's also educating healthcare providers. There is a degree of vaccine hesitancy within healthcare providers. And we need to make sure that we are the example and leading by example by getting the immunization. But I would also say that part of it is going to be about how do you manage that demand and using technology. So what we saw in the instance this year of the flu vaccine, we had 500% increase in demand over this time last year. So if that's any indication, that's going to be a big challenge. And what we learned is that the walk-in or on-demand type of service is very challenging in COVID. Obviously, the pharmacies have retrofit and put in place a lot of safety measures and enhanced protocols for sanitation, physical barriers, PPE. But there's a higher risk here with the volume of people coming into a pharmacy. So it's our blessing and curse, right? We have that accessibility and convenience with a footprint in every community with pharmacies as healthcare hubs, but it also increases the risk to community spread. It increases the risk to pharmacy staff and the pharmacists. So utilizing things like appointment-based modeling is something that has really taken off here. And in fact, we are doing COVID testing in pharmacies in 2 provinces out of the country, and one of them is Ontario. And it was mandatory to participate in the program that you utilize some form of appointment-based modeling, so that 2 things. One, you could have the right labor that you need. You can resource allocate ahead of time, so if you need overlap of pharmacists in order to maintain the operations and continue with dispensing and clinical advice while taking on that surge of demand of patients coming in, but also do it safely. So you can maintain the social distancing, and you have the right frequency of bringing people in. I've seen some pretty innovative models where there's 3 rooms being rotated, and then you sanitize it and you wait the obligatory amount of time for that to be disinfected. And then you go to the next room, and then that room will be available for the next patient. So there's different ways to manage the demand. And this is why community pharmacy is, I think, an important partner in distributing and administering the vaccine, is because we've already gone through this with the flu. We have all of the appropriate measures in place to keep everyone safe and do it effectively. But I don't think we can do it solely on a walk-in on-demand basis, which we used to do for the flu shot. That was one of the nice things about it, was people could bring their families and they didn't have to worry about scheduling. And it was pretty much on a real-time basis. But we're in a different world now with COVID. And the challenge of stores, footprints that are quite large, is that you have also the commingling of those that are there for a COVID test or a vaccination or to pick up their meds versus someone that's buying something else at the pharmacy. So you want to manage that flow of traffic in the store. So I think that is a lesson learned. The other lesson learned is to make sure that it's consistency of the information. We do have education, professional development education on immunizations and vaccinations, and that's something that I don't think the pharmacists need any training per se, but the adherence issue here is going to be key, because outside of Janssen, all of the ones that I've seen that are showing promise and going through the regulatory and approval process require 2 doses. Some are 21 days apart, 28 days apart. I think the Pfizer one is 21 days. But how do you make sure that you have that communication with the patient, utilizing perhaps mobile apps and things of that nature, reminders? Pharmacies do this today, right? They have that omni-channel approach to communications and customer service. So because you don't want the patient to not come in for the second dose, and then the efficacy of the first dose is significantly reduced. So that's going to be key too. And I think pharmacists are a turnkey solution in terms of that communication with the patient, making sure they do come back in for their dose. But I can see a risk there in terms of adoption, because we know medication adherence is an issue. And we want to make sure that those people that get the first dose don't forget to come in for the second dose.
Yeah, there's different also elements involved with that, which we're going to touch on with workforce. But I do want to ask you about tracking systems. So you need a tracking system both for the supply, like do you have enough vaccine, tracking did they get the first dose, and then when they need to get the second dose, and then tracking even of adverse events, or even continuously determining the efficacy of the or the effectiveness of the vaccine. So what tracking systems are currently being put in place that you know of to help with these issues?
Yeah, so from a Canadian perspective, we have what's called Panorama, and it is a vaccine repository of information. It's federal, so that does populate, and there's a surveillance component to that, not specific to COVID, but certainly has been in place for a number of years. The challenge is it's not integrated into the community system. So, you have some gaps there with respect to the real-time component of reporting who's been vaccinated and supply. I think pharmacies typically, because of the billing process, we bill into our system here has private, public as well. So in Ontario, about 55% of all patients are coming in on an employer-sponsored plan, private insurance, but 45% of the population have coverage through like a Medicare or Medicaid type of scenario in a Canadian context. So, but on vaccines, this is all going to be publicly funded. So no one will be charged. It'll be covered by government payer. And in that instance, pharmacy has a bit of an advantage because of our billing system. So when they want to know how much vaccine is out there in the community and or been administered, because those are 2 different stats, I think the value we have is that they can be able to look at the reporting on a daily basis and know exactly what has been distributed to pharmacy. They can't necessarily do that with other primary care providers. They won't know how much has been out, and it's a delay, sometimes of 30 to 60 days. So, that's going to be important. The real-time functioning of this is not there. So we have to build out that capacity. But I know so there's kind of 4 areas that the governments are trying to solve in a short time. One is that access, distribution, allocation component, who gets what and when. The other one is more around education and outreach, and then data and IT play a component of what you're talking about, and the clinical and surveillance, right? So those are sort of the key areas that the task force that's been established by the government, who has subject matter experts around the table, including a pharmacist. They're going to try to figure all this out in short order, but it is disparate systems, so it's going to be challenging. But the manufacturer does surveillance, we've got government systems, and we need to bring all of that together to know that if there are side effects, there are mechanisms in place today within pharmacy to report that, and there's an obligation if there's today with any medication, if there's a side effect or an allergic reaction, anything along those lines, contraindications, it would be submitted into Health Canada, into a national database. And we also have a national database for drug shortages reporting that is a obligatory requirement for manufacturers. And there's different tiers to the drug shortages, from tier 1 to 3. In a similar fashion, we have that for reporting adverse events from medication. So, I would say that there is systems in place and processes in place in order to manage that. The question is, how do you coordinate that on this scale with this many healthcare providers participating in something as big as this? So I think we're going to find out, and we're going to try to, make it work as best we can. But the integration of all the systems isn't necessarily one of our virtues here. We have provincial systems that don't talk to each other, and then you have within the community. So it's going to be a bit of a patchwork.
I think what you mentioned in terms of what exists and then what we have to create, I think throughout the week too, we've been talking to different experts about what we've created, right? Like we've now created an app here in the United States that you can track and like when you get the vaccine. So those are new things. But then as you also stress that even though certain systems may exist, are they optimized to meet that need? And I think that's very important for those that are listening as they evaluate their own either institution or local level, is to exactly to Justin's point about what currently exists, but is it truly optimized to meet the needs, and how can you do that? And I think that's very important. You also mentioned about what is required to report, what is not. And let's go on to the next question about whether you think the COVID-19 vaccine will be mandatory or voluntary.
Yeah, thus far, the indications that we've received, at least here, will be voluntary. The mechanism to enforce this is not an easy one or necessarily practical. And I think the approach is more around nudging the population to get it through public education, enabling and mobilizing, perhaps a whole advertising public relations campaign behind this. And part of what we're doing with primary care providers is we've got working groups established of how can we demonstrate leadership. I think politicians can be a part of that too, by being very public about getting the vaccine. And I believe that once we get over the initial, stages of this in phase 1, when we see that it is safe and effective, it will end up bringing more and more people to it. The concern, of course, is legitimate one. People are looking at this and they see the speed of what would normally be a time to market versus what's happened here. But the reality is, it's all been in I think a very intense period of time with lots of resources thrown at it. So we've been able to accelerate the timelines for approvals and things like that. But we know the science behind it is sound, and there's going to be a cohort of people, and there are today, that will, conspiracy theorists and anti-vaxxers and anti-maskers. I mean, they're out there that will never get a vaccine of any sort. So the question is, how do you manage that? And we don't know how long this vaccine is going to be effective for, and we don't know about this idea of reinfection yet. And we've heard, there's some evidence to suggest people can be reinfected. Will the vaccine support, will help protect against that and defend against it? So there's still some unknowns, but I would, we're targeting about 80% of the population based on some of the surveys that have been done. One survey that was done by the Canadian Pharmacists Association, of which we're a member organization of, showed that about 75% of people will get the vaccine that are confident in getting it. And out of that, 65% said they would get it at a pharmacy. So there's strong numbers to suggest that this will be the majority. And I can see, you talked about technology and some of the things, even with COVID testing now, you need to travel in a lot of destinations, a lot of airlines, you need to demonstrate you've had a negative test for COVID, and it has to be a PCR-based test and within a certain time period. Well, I can see something similar happening. And there's apps out there now that show like that passport book that, yes, I've had a COVID test. So this could be applied. The technology could certainly be re-engineered to apply for the COVID vaccine to show. And we have vaccination cards today and that sort of thing. But I could see a requirement if you want to travel that you have to prove that you've had the vaccine. And that may be less mandatory from a government standpoint or public health, but more from a societal standpoint. We see this today, right, with restaurants and so forth, where there's people that aren't necessarily taking the measures seriously and putting at risk others. So it's a real challenge of our time of how much of it, it's a balance, right? How much of it do you enforce? With mandatory lockdowns, particularly in the US, you're seeing a cohort of people really be opposed to that, the idea of personal freedoms and, where government intervention should start and stop. But as, putting yourself in the shoes and in the position of government, making decisions about protecting and saving lives, and also managing and balancing that with the economy and the economic impact is huge. It's just enormous pressure, and I don't think anyone envies those decision makers. But one of the things that I think is going to fall out from all of this and this whole pandemic, and I think it's true of the vaccine as well, is we've seen the hardest hit parts of our society are those of lower socioeconomic status. Indigenous communities, impoverished communities, gender and race have played a role in terms of impacts of the COVID pandemic. And I think access to the vaccine could also follow similar trends. And that's what we want to avoid when we talk about equitable distribution, particularly in vulnerable populations. And if we don't get the vaccine out to those populations, then we're going to be in a situation where we'll never be out of the pandemic. And there's a lot of discussion about that from a global perspective, where you have rich countries like the US, Canada, Europe that are getting access. They have procurement agreements in place with Moderna, with Pfizer, and there's more poorer countries or countries that are not, they're developing nations that do not have those agreements in place. And I've read quite a bit of literature out there that says, you're not going to solve this globally, and it will impact the rich countries as well if you don't get the vaccine in the hands of all countries in an equitable way. But we're seeing the distribution already is not equitable from that perspective. The poorer nations aren't getting the same access and the same time to the vaccine. So that could be a long-term challenge of really getting this thing completely put to bed and be moving on from the virus.
Do you think, though, and these are great points in terms of now with the equitable access, do you think, as we're thinking about setting up the infrastructure to provide equitable access, and I know many institutions depend on their regulatory body kind of guiding them on the phases at which to do this, but are there recommendations, is it a thought process? Is there something that we can do now to ensure that, when the phase comes or the rollout for specific populations that we know have been disproportionately affected by COVID, that we make sure that we don't drop the ball there, that we make sure that things are good? I mean, what should we start to think about when we think about those populations now?
Yeah, I think part of it's an access issue generally, right? If you look at access to a pharmacy, access to a primary care provider, we know that those in Indigenous communities and in impoverished neighborhoods don't have as much access to healthcare services. So I think one of the solutions will be to bring the vaccine to them. And that could be pop-up vaccine. Obviously, that's going to be difficult with the Pfizer product, but I can see that perhaps with the Janssen product, if that eventually gets approved, where it's a single dose, and you bring that mobility to and flexibility to do vaccinations in schools. I can see in employer locations, in complexes of affordable housing, there's a way to target those areas with much more of a flexible care model. If you're going to rely on them coming to you, I think that's going to be problematic, frankly. We see that with other access of healthcare services. So being innovative in our approach, this year for pharmacy in Ontario was our first year we could take the vaccine outside the four walls of the pharmacy. So up to this year, it was very restrictive in that you put it in your cooler and go to a remote community or go to a first responder and vaccinate them. So you were relying on very much a pull model, right, and getting people in. And, I think it's proven this year with the highest vaccination rate we've seen that taking the vaccine to the people is what you need to do. And that's enabling all the healthcare providers to do that. So that's one way to do it. Education targeted to those communities as well, I think will be important, underscoring the value and importance of getting vaccinated, and dispelling some of the misinformation that's out there. And I think that is going to be a key point of this, and investments, right? I mean, it's that has to be part of the consideration of distribution. And I know that is part of the priority groups that we are targeting for the first phase for those very reasons. And, those that have comorbidities or are high risk populations in the senior community, and then the healthy person like myself will wait for the vaccine. And I think that's perfectly fine. And it's the way it should be.
So do you find, actually, also to build on what you were talking about, communication strategies of various, do you find that your messaging has been consistent? You just do more of it in terms of the various different stakeholders, or have you found yourself constantly adapting your messaging? I think so many people right now are thinking about how do I communicate the correct information? How do I talk to them? What's the process? Because we know that's a big hurdle we have in this whole process. So what strategies would you suggest as people start thinking about communication?
Well, I think we can improve on that from a system perspective. And in Canadian context, you've got public health. So you've Ontario Public Health, and then you have these regional public health units. And I'll give you one example. We have about 23 in Ontario public health units, and they're all setting up their own task forces and doing their own messaging. So to the degree that that's coordinated and flowing up and being disseminated, I'm not entirely sure, but it's a fragmented system we operate in. So lots of room for improvement around transparency of communications, consistency of that material, engagement and input from the various healthcare providers so that they're part of the process of developing and co-creating that material, which is why I think it's so important to ensure that you have the right groups of people around the table that's representative, that can identify the risks and the different gaps to what needs to be considered. And that way, it's really looking at it as it's going to take the entire village in this scenario to be able to be successful, because your points of care are going to be the biggest touch point that the population is going to have, whether it's a physician or a nurse or a pharmacist, and they all need to be basically singing from the same song sheet. So we are working on that within that group I referenced, the working group, some key messages that can be distributed to everyone. We're doing polling. There's a poll or survey that was put together that will also go to each of our respective associations and healthcare communities. So we're gathering the data and information, and we're going to use that to inform the key messages and then liaise with government and other authorities to ensure that it's the same message. Because the worst thing that can happen is having different messaging out there that confuses people, and also could lead to non-adherence and just, I don't want to bother getting it. So and I think it's education, not only about the safety and efficacy of the actual vaccine, but that, the importance of getting it because of COVID. There's still misinformation out there. I mean, we see it every day, whether this is a hoax or not, the COVID vaccine or the COVID pandemic itself. And, the misinformation is I think our biggest risk. We need to educate people on the numbers are staggering. We see it every day, but there's still parts of our society that don't agree with how severe the situation is and how much of a strain it's putting on the healthcare system, because that's really where things are going to break. It's the stress and the burden on the healthcare system. It doesn't have enough capacity to deal with this through ICU beds and just the overall healthcare system capacity. And that's why notwithstanding all the other things we talked about keeping people safe and keeping the economy open, protecting public health, the system itself can't manage this burden. So getting people vaccinated is our best chance, and not only safeguarding the population, but keeping our system available for all the other things that are going on.
Yeah, I definitely agree. The misinformation component is something I worry a lot about too, because if you think about the general public, by the time, and you had mentioned this, by the time the general public gets vaccinated, it'll be quite some time, right? And so you have to keep the momentum up also for those that are waiting to get vaccinated and kind of waiting their turn, kind of understanding that process. And then there's just so much information out there. And it's just one element is like, how do you keep up and like ensure that your messaging is going out as fast, but at the same time being very targeted and intentional. And I loved your suggestion and the importance of bringing in those within those communities to design the communication strategy is also very, very critical, because communities are very different, right? And so
different languages, different, same message, but, being sensitive to that, and also about protocols, even if you've had the vaccine. So a lot of material now out there about whether you should wear a mask or not, right? Once you've been vaccinated, and recommendations coming out of public health. And this has been our challenge in the pandemic in general, is that we're learning, and the science has changed, right? Because the reality is we knew very little when the first infections happen in China, and then even the World Health Organization updated guidance throughout it. And that's what you want, right? The more you learn, the more you update the guidance. But now we know that wearing masks is important prevention strategy. But the recommendations coming down that I've seen is that you should continue to wear your mask because of the threat of reinfection and some of the other unknowns. So, that's going to be need to be consistent as well. What are the protocols moving forward? Do we just go back to a new normal, right? And it'll be interesting, again, from a culture and society standpoint, what does that new normal look like with the vaccination rates being high at the end of the year? And also knowing that this is not, I was listening to somebody earlier today, it was interesting, it was a government official, but they said, for us, our Canada Day is like your July 4th. So ours is July 1st. But if you're looking at Independence Day, July 4th, we're not going to be back to normal by the summer. We're not going to be back to normal in the spring. We're certainly not going to be in a normal situation for the holiday season coming up. And that could actually exacerbate the situation if people don't abide by some of the protocols and get together and so forth. So we saw that with Thanksgiving in the US, and 2 weeks later, we're at where we are now. So this isn't going away in 2021. Our lives, if we're fortunate, our lives will get back to some new normal by the end of the year. But even that's a stretch, right? Like it could go well into 2022, which is a bit of a daunting thing to say, given the challenges that this pandemic has presented and the disruption in our lives. But, I think the key here is it's not going away anytime soon. So we need to be vigilant in our safety protocols, including wearing masks and washing hands and keeping that safe distance, regardless of whether you've had the vaccine.
Yeah. I definitely agree there. And I think you also made a wonderful point earlier, and it was a theme, I think, kind of across many of our speakers this week too, about healthcare providers kind of being the ambassadors for the vaccination process as well, because they are within the first phase. And I think we'll see that more as the populations kind of progress in terms of who gets vaccinated, where their role will be even more instrumental to also help the vaccination process. So I think that's great as well. Just trying to make sure. Oh, I did want to also ask about, and then for those that do have questions, please submit your questions in the Q&A box. And so we're going to get to those shortly. I did also want to make sure to ask about outcome metrics that you guys are using as you think about the different campaigns, the vaccination campaigns. Is it just how many people are vaccinated, or are there other sorts of markers that are helping you along the way as you build out these programs or work with various stakeholders to ensure?
Yeah, certainly vaccination rate will be the gold standard, knowing how many people got it. But I also think demand patterns, where are people going to get the vaccination? ultimately we want to make sure it's as accessible and convenient as possible, which is going to require everyone to be involved. But there are shifting demand patterns. What we saw with the flu season this year, where the people weren't able to get it because it ran out. So the whole ordering process and how do you replenish and what's that timing look like is going to need to be essentially ironed out. And transparency, I think, and communications on this is the number of people that have been vaccinated, and that whole surveillance piece, the data we talked about, right, with the adverse events and so forth that are going to be critical, and the underpinning of confidence behind this entire system of being able to mobilize and be able to take on this challenge. And the outcomes, to me, are ultimately going to be measured in how effective is the vaccine for how long, and also the side effects and anything that we need to monitor, any unintended consequences that may come from it, and then how many people at the end of the day, the actual vaccination percentage of the population.
Yeah. And I like how that you're thinking about those other metrics similar to many other institutions and organizations about how there's still some information we don't know in terms of how long is it effective for. And so being able to track that and understand that is going to be very powerful. We do have some questions, but I do want to ask you any final advice that you have for those that are preparing for the vaccine before we go into the Q&A.
Well, I think there's going to need to be patience, right, through all of this. I mean, perseverance and patience. The healthcare system has been under siege for the better part of 2020. There's burnout across the system. And I think, the real heroes of all of this have been the frontline healthcare providers who have really stepped up to provide optimal care under difficult circumstances. And I can't underscore that enough, just how challenging it's been. And this isn't going to, free up their time. It's going to add more time, but it's all for the right reasons. And I think healthcare providers are ready to step up and provide the vaccine to as many people as possible. But, I think we need to urge the public in particular, if it's, anything similar to the vaccine for flu that we went through this year, in the early part of the season, there was a lot of frustration about not being able to get it. And there was this mass surge at the very beginning of the flu season. So the question I have is, a couple questions on the flu season. One, is it an anomaly because we're in a pandemic? Will we see that demand be translated into the vaccine for COVID and into next year's flu season? Or is this strictly result of the current pandemic and greater awareness? And also, what will we do with that demand surge, right? How do you, we've got the prioritization, which I think is going to be critical. So not everyone's rushing to get it day one because there won't be enough supply to meet that demand. But over a period of time, there will be, because as you know, manufacturers deliver this in waves. It's not all dropped to the various locations day one. So it's going to take that coordinated effort, and also try not to, as best we can to make sure we reduce the wastage and spoilage so that every vaccine is put into an arm.
So we do have a question on, we know that the vaccine you have to have 2 doses for, and so the multiple systems right now that are in place is where you have to go to one institution and get those 2 shots. Do you see it later in the future, or even in the immediate future, about getting maybe 1 shot if it's still the Pfizer? Because if you get the Pfizer one, you have to get the second shot also has to be Pfizer. But do you see us going to different institutions, or even maybe, I know we border each other in Canada and the US, somebody maybe going to Canada to get the vaccine? Do you see us traveling to get the vaccines between institutions, maybe between countries, or is that too much of a logistical nightmare?
Well, I think it's a real problem that needs to be certainly discussed at the appropriate tables, because I don't think you want that necessarily, right? You want it as close to home and where you work as well. We mentioned about the mobility components and accessibility, but it might be a reality. And how many of these vaccines will be approved, and who should get what vaccine? I mean, that's a huge component. Like, who would qualify as best to have the Pfizer one? I mean, it's the only one available now, but when you have 5 or 6 of them, they're all going to have slightly different formulations. And I think there's a whole clinical aspect aspect to that that's going to be critically important in the guidance. And that could be very confusing to the population as well. I mean, should I go to my primary care physician for, A, B, and C, or X, Y, Z, a vaccine here, or should I go to my pharmacist who has a completely different vaccine? So, that could be one of our bigger challenges in that complexity, because anytime you're communicating with the public, you want to do it in the most simple way as possible, right? Here's where you go, and here's the the result type of scenario, and that may prove challenging with the different vaccines out there. So it's a good problem to have multiple vaccines, but educating both healthcare providers and the public on where to go and which vaccine is going to be critical. And I think you want to try to reduce as much mobility as possible. You don't want people to have to go far and wide to be able to get something, because I think the research shows the farther and more difficult it is to get something, the less people that will do it. And I use the example of voting, right? So, if it's a hassle and I got to line up for 6 hours and I got to drive 40 minutes to the polling station, or I can do a mail-in ballot as one example, right? I'll go with the convenience. And same thing with online, shopping and those types of things. People opt for the most efficient and the best way to get their information and digest it. And if we make it hard and we make it complex, then I think you'll see the downward impact of that will be less people will get the vaccine.
Yeah. There's definitely two. I mean, the logistical challenges are also going to be for both, in terms of if you're getting the vaccine, thinking about where you want to get it now, where you want to get it again in 3 weeks or 1 month. And so I think that's a factor many people have to take into consideration. So
my hope would be that it would be the same healthcare provider, because that's where your information is, and exactly what was taken. If we don't have an integrated system, it's going to be very difficult for, let's say you go to a completely different pharmacy, or you go to a family care physician the next time, and them sharing that information isn't always optimal because of the systems and so forth. So that could create a logistical nightmare in terms of understanding where, and you're relying then on the patient recollection. So I think we're going to really need to streamline that, and you raise a good point.
Yeah. And I think too, the fact that we're starting out with healthcare providers, other than the fact, like you said, they've been really the true hero throughout all of this in terms of being the frontline workers. But I think also starting with that group in terms of centralizing and understanding our logistics and trying to understand behaviors within our communities too, it gives institutions a lot more time to, and you have to be intentional about thinking about what your needs are, right? Your community needs are at the same time. So hopefully that will also build, like, you'll begin to understand your community in terms of, are they interested in getting them at multiple different destinations, and, depending on that. So it'll be interesting to see as we move forward that. So we only have 1 more minute remaining. Are there any final thoughts you would like to add, or anything before we start closing out?
No, I think it's a great conversation, and we need to keep having these discussions and bringing in different perspectives so that we can understand where some of the barriers might be, and what the opportunities are to ultimately all of our shared objectives and outcome here is to get as many people vaccinated as possible. And I think about it as, as customer service, right? You want to make it as easy as possible for someone to pay for the product that you're offering. And it's no different in this sense of a vaccine. You want to make it as accessible, as convenient, and as easy to get. And it should be free, in my opinion, to the population, and that will entice, or at least provide more incentive for people to get it. And I think that's where globally we're going. And I also believe that we need to make sure that the underserved and the vulnerable populations are prioritized and continue to be prioritized in countries and within our own domestic policies, and dealing with our regionalization. Because if we don't do that, we won't have an effective strategy to wipe this virus out and return to whatever new normal will be waiting for us.
Yeah, I agree. It's not over until we are all vaccinated, until we are all safe. And I think that's a great way to end. And I agree. There is so much that we can learn from each other, especially as, even if you think you don't have to have the exact same systems, but you do realize with these conversations that we all have challenges that we're trying to address, and sometimes challenges in a completely different environment. Just by discussing that and bring that to light you begin to realize, oh, do I have that challenge where I'm at as well? So I think there's so much value, and thank you so much for having this conversation with us and shedding more light on what Canada is doing, but also what we can all do to ensure equitable access and ensure that as many people as possible, like you said, are able to benefit from the vaccine. So on behalf of Salus Vitae Group and myself, I would like to thank you, Justin, for joining us today and sharing your experiences and what the future has in store for us, even if the future is only 1, 2, 3, 4 months away in terms of how we're thinking these days. But thanks again. And for those, this is actually our final live webinar for the week as part of the series. The replays of all the previous webinars will be available in a couple of days, so please look out for them. And again, if you have any takeaways you would like to share, be sure to tag us at Salus Vitae Group, because we would love to see how you benefited from this session. So thank you again and have a wonderful day.
My pleasure. Thank you. Take care.